Hey, good morning, YouTube land. How's it going, guys? Dr. Dan here. Thanks for joining me. Monday morning microdose. Good to have you guys with me. For all you guys tuning in, all of those still in bed, don't worry. I don't blame you. I had to drag myself out. I feel super disorganized always on Monday, folks. If any of y'all ever catch this, doesn't look like a whole lot of people are tuning in right now anyway. It's all right. I don't give a shit. It's totally fine. I realized I tried to put way too much effort into producing, the quality, always safe for the audience type stuff. Sometimes I tend to go off the rails, and I think I'm just gonna embrace it. Just gonna go for it now. It doesn't make sense to just diddle around. I might as well just toe myself all the way in. So good to guys have you joining me. Let me get some of this coffee. I don't know why I'm playing around and trying to get this stuff done on the live cast without caffeine. It's bullshit, guys. It doesn't make sense. Please have enough water. Yes. Why would I try and bore you guys with my uncaffeinated dribble? Let me make sure the sound is good. Hey guys, if this sound sucks, let me know. Right? Give me the thumbs up. Be like, hey, good morning. Hey, Crystal, how's it going? If my sound is bad, guys, or if I sound fuzzy, whatever, let me know, and I'll try and make an adjustment. I'm not a pro at this YouTube thing, as you can see. I know you guys, you're probably more entertained with the cat videos and all this other stuff that's hyper produced. That's wonderful. I get it. I don't blame you. It's probably more interesting things to do on a Monday morning than hang out with the disorganized Monday morning cannabis physician. But I dig doing what I do, guys, because I'm in a very cool and privileged position in that I get to help patients get their legal marijuana cards in the state of Arkansas. And we're soon to expand to other places, but that's another day, another talk. More importantly, guys, I just did want to touch on stuff. I know that mental health is a big thing that I've been touching on a whole lot lately. As a side note, the weather is nice, so it's good to get that rebound. Morning medication or not, here or there. Good to wake up the mind and just sort of get the limbic system activated and in tune with the harmony. Need the caffeine. That's what I keep telling you people, right? I'm not talking out of my anus here. I promise you. Cheers. All right. Good morning. Love you guys. Thank you for the support. All right. Oh, wait, I can't logo. Oops. Boom. Thank you again for the support, guys. Thank you for all the wonderful questions. Guys, just a little bit of history while we touch on stuff. I want to veer away from the PTSD just for a moment, because there's a lot of things, a lot of ancillary symptoms that come across the cannabis clinic that are related to PTSD. A whole laundry list of symptoms. I'm talking about physical symptoms. And in some circles, you'll hear this word called somatization applied to it, which is basically, in a nutshell, physical manifestations or perceived physical manifestations of an underlying mental health issue or a neurologic issue, right? It could be a strictly neurologic issue for which you have a physical or perceived physical manifestation. For example, the nausea. What I want to touch on specifically is anxiety-related nausea and the whole anxiety continuum. PTSD falls within that anxiety continuum that includes OCD, generalized anxiety disorder, and a flurry of other players in that continuum that are just related to hyperarousal and, at the end result, hyperactivity of the sympathetic nervous system that controls the fight or flight response. And long-term, what happens with that is you get cardiovascular stuff. But the nausea at hand that we're talking about today is, a lot of times you'll get anxiety-related conditions with coexisting nausea. okay, the emetic reflex that comes with it, and cannabis just super useful for it. Cannabis is, I guess we'll call it marijuana, weed, weed's effectiveness for nausea, long documented back from the time really how it jumped on the scene for treating cancer patients' nausea and addressing the cachexia and anorexia component. Anorexia, not wanting to eat, not having the hunger drive to eat, and the cachexia being, frankly, the loss of lean muscular body mass. Okay, just to differentiate the two, if you guys want to dot the I's and cross the T's. But cannabis, well known and well established for being able to address the nausea component that precedes the food aversion. Realize that the cachexia and the weight loss, the idea of being able to hold positive calories as opposed to going into catabolism, which is net negative calories. I like to go over the nomenclature a whole lot, guys. I like to nerd it up just so you guys can have these, have some of these ideas explained to you, just so you can have it by and by. So if we get into this discussion again, because all these concepts are important, we can go over them repetitively, just so we can get a better grasp of what's going on. So, the problem is nausea and being able to feel good and happy about the idea, even the mere idea of getting food into the stomach, whether it be a person who is on chemotherapy or recovering from that and still trying to gain weight. Marijuana, well known, well established from decades ago, actually, if you look at the Israeli literature, well established for treating nausea very well. Nausea treatment going back to, I believe, far back in England. I'll have to look up the O'Shaughnessy papers, I believe, that relate to treatment of nausea way back in the 1800s in the United Kingdom, and well established. I'll have to get the quote, but well established there. So for whatever the primary cause, if nausea is the secondary symptom relating to a primary cause, either way, marijuana, well known and well established to sort of get the two-hit punch with the jab and the uppercut to address both the anxiety component when that's the underlying thing, address the anxiety component that might be preceding the nausea component and the food aversion. Sometimes the anxiety component is the patient thinking about being hungry and wanting to be hungry, but then knowing that the hunger will bring about the nausea that precedes the vomiting. Nausea and vomiting, not the same. You can have one without the other, but oftentimes they go together. So just the thing I wanted to touch on, folks, before I jumped into the actual grind of seeing the patients. So I always enjoyed doing it. Well, that's probably a lie. I like the weekends. I like when I'm not doing it, but I do enjoy, I think it's really a privilege to be able to be at the point of contact where if patients have questions regarding marijuana, they don't feel like they have to be judged, and I can give them input as to what I've read and what I know and the benefits as well as the limitations. I like to be straightforward with people. When they ask me if it can treat and cure, when people say words like cure, I'm very quick to say, well, cure, we'll see. But, in terms of treatment, I like to let people know what we can expect in terms of risk and benefit, because that's what the discussion comes down to all the time, whether or not we're talking about, strict pill type prescriptive medications. And there are instances where those are necessary. Medical marijuana cannot replace thyroid medication. It's a hormone. So, we like to talk about those things where we can get stuff done and where we can't get stuff done. Medical cannabis not known to treat hypercholesterolemia, if you're on Lipitor, that kind of stuff. Not so far as I've seen in the literature, not to any compelling degree, not yet. All right. Other things well established: the nausea, well established; anxiety, insomnia, these things, muscular spasms relating to multiple sclerosis. Excuse me. The water, thank you, and the caffeine necessary. Multiple sclerosis. Thank you, folks. Thank you for being patient. Gotta get the coffee in me. I don't know why I keep trying to, on the Monday, folks, don't try and here's the take-home lesson. If I'm going to be the jackass, right, to pay the price, so you guys get a wonderful look. This is a privilege. You guys get a wonderful look at sort of someone else playing the fool. I don't know how to do this YouTube stuff, so you get to watch someone else sort of play the fool and fuck up in front of people, which is the great joy in doing the live cast, right? Because you fumble up, you say you go blah, 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 and all this jazz, so people get to see it before it hits the editing room. So that's always fun. I realized I was doing one of these and I had some stuff in my teeth. That was neat. Thank God. I don't think I've had a booger yet. So you guys, please let me know. I appreciate the feedback. I'm not infallible here. So anyway, you guys, hopefully your Monday morning will go far more organized than mine. I really appreciate you guys joining me in doing this. I do have a meeting. I think I'm actually late for it. I've got to run. God, the business part, I'm falling. Hey, look, guys, love you guys. Cheers. Marijuana, great for nausea. Thanks for being with me on this IDGAF Monday, NSFW, FFS, guys. Come on, let's loosen up. Microdose Mondays. Do it in the proper dose. Have fun, guys. Bye.